Chapters 41 to 45. Watch until the end. Overview of anaerobic organisms.
In this topic, we have the endogenous and exogenous anaerobes. Various species and genera exhibit
Endogenous
preferences
anaerobes.
from the body sites they inhibit. This is Clostridium botulinum. And this is Clostridium tetani, an example of exogenous anaerobes. These are soil and environmental inhabitants and are considered part of the normal microbiota. And did you know that these two organisms here produce some of the most potent toxins known? Anaerobic organisms commonly contaminate clinical materials.
Gram-positive, spore-forming bacilli.
The Clostridia are indus-forming obligately anaerobic or aerotolerant, catalase negative and gram-positive bacilli. These are some strains of Clostridium perfringens, Clostridium ramosum, and Clostridium clostridiform. And these may not produce spores or survive spore tests. So, this is the fun fact that it is important to recognize these organisms by using their characteristics.
Laboratory diagnosis and specimen collection.
These species, the C. perfringens, should be transported at 4 degrees Celsius, and specimens should be processed within 24 hours. And this is the gram stain of Clostridium perfringens. Just so you know, specimens should be gram-stained, cultured, and isolated. And what you see here is Clostridium perfringens in blood agar. And as can you see, polymerase chain reaction testing is available for Clostridium perfringens. This is the picture of Clostridium difficile infection. This is an example of Clostridium difficile on CCFA. It indicates the collection of freshly passed stool specimen for cultures and toxin assays. Specimens should be cultured within 2 hours after collection. This is botulinum toxin, a potential bioweapon. This is for the diagnosis of Clostridium botulinum and Clostridium tetani infection.
Gram-positive, non-spore-forming bacilli.
These organisms are typically found as normal microbiota on the mucosal surfaces of the digestive tract and urogenital tract and on the skin. A polymicrobic infection.
Overview of anaerobic organisms. Part 2.
These organisms are actinomyces and mobiluncus. Actinomyces are anaerobic and aerotolerant, while mobiluncus are strictly anaerobic. This species show non-acid, fast, gram-positive, pleomorphic branching rods or cocobacilli. This is a cause for bacterial vaginosis and is usually diagnosed on gram staining of vaginal secretions by observation of gram-variable curved rods with tapered ends.
Gram-positive, non-spore-forming bacilli.
This is Actinobacillum species are typically rod-shaped facultative anaerobes that are normally microbiota of the human genitourinary tract. This is Propionibacterium species are anaerobic and aerotolerant. Pleomorphic, gram-positive rods, the bacterium produces propionic acid from glucose. And this is Bifidobacterium species are strictly anaerobic or microaerophilic. Gram-positive pleomorphic rods that appear as rods or as branched or club-shaped. And this is the Lactobacillus species contain microaerophilic catalase negative and gram-positive rods capable of producing lactic acid from glucose fermentation. And this is the genus Eubacterium. remains poorly characterized, although its species are commonly isolated from oral infections. These are Egerthella. Egerthella and Para-Egerthella are associated with intra-abdominal and peri-abdominal infections, as well as bloodstream infections, which have a high mortality. In laboratory diagnosis, differentiation of gram-positive non-performing anaerobes is based on hemolysis, fluorescence under long-wave UV elimination, and colony and gram-stain morphology, including this.
Gram-negative rods.
Bacteroides fragilis group. They are isolated from the mucosal surfaces of the human oral cavity and gastrointestinal tract. These are Bacteroides fragilis from bile esquilin agar and anaerobic blood agar.
Pigmented Porphyromonas and Prevotella
This is the
spp.
Porphyromonadaceae family, comprises of 5 genera. Porphyromonas is generally considered as the pathogenic genus, and these 7 are commonly isolated from humans. Chapter 42, Mycobacteria.
Hi everyone, so today we will be talking about Mycobacterium tuberculosis, or as it's commonly referred to as TB. Now before we start, I would like to briefly talk about Mycobacteria itself. It's called Mycobacteria because it contains a unique substance in its cell wall called mycolic acid. Mycolic acid contains lipids, making the cell wall of the bacteria a lipid-rich cell wall. Mycobacteria, also called acid-fast, this is because they are resistant to decolorization by acid after staining with carbofuchsin, therefore they gram-stain poorly. So what do we use to stain them? We use something called Ziehl-Neelsen stain. This stain is used to detect mycobacteria, especially TB, out of all Mycobacterium species, namely Mycobacterium avium complex, Mycobacterium canasi, Mycobacterium leprae, and Mycobacterium tuberculosis. TB is the most important one and the one we will be discussing today. The name tuberculosis comes from the word tubercle, which means round nodule. Therefore, tuberculosis means multiple round nodules. So now, let's talk about the features of the TB. Firstly, it is an obligate aerobic bacillus, which means it requires oxygen to grow, and that is why it makes sense for TB to prefer to go to the lungs. Primary infection usually occurs in the lower or middle lobes of the lungs, while reactivated TB prefers the upper lobes as it has high VQ ratio, which means there is a lot of extra O2 and ventilation present that is perfect for bugs like TB. Secondly, it is a facultative intracellular organism. This means they can live inside other cells when they need to, and one thing you need to always remember is that TB infects macrophages.
What is non-tuberculous mycobacteria?
This type of bacteria that typically are found in soil and water in the natural environment. People with CF can acquire NTM similarly to the way they acquire other bacteria, typically by inhaling it from the environment, and because of CF, there's a challenge with getting bacteria or other debris that we inhale out of the lungs that can take hold and develop an infection. Currently, it appears that most people who have NTM found in their respiratory cultures actually don't go on to have health problems related to that. NTM disease is a condition that we diagnose when it appears that the person not only has an infection that shows up in those repeated cultures, but it is causing a decline in their lung health. This can be pretty challenging, and so we have to consider a number of different criteria. The first one is that the infection is found in repeated cultures, and so these are typically sputum samples that have to be obtained. Secondly, the individual is showing a decline in their lung health that can't be explained by other causes. Typically, there are other bacteria or other infections and can often part of that. Typically, there are other bacteria or other infections and and often part of that. Overall diagnosis includes a CAT scan of the chest and the lung to look for a characteristics picture that may suggest that this infection is causing damage to the lungs. Overall diagnosis includes a CAT scan of the chest and the lung to look for a characteristic picture that may suggest that this infection is causing damage to the lungs. This particular bacteria is quite hardy and so it's resistant to many antibiotics, and when treatment is required, it can be quite complicated and prolonged, involving up to several months of antibiotics. Unfortunately, that is not always successful in treating the infection and eliminating it from the lung, and it can be associated with significant side effects, particularly damage for one's hearing or kidney functions. So there's a lot of good work going on looking at and not tuberculosis might be bacterial infections in CF. There's a research looking into how we can repurpose existing drugs that may be useful to treat NTM. Some of these early candidates may include acrylonitric oxide, gallium, and others. That's all for today, guys. Thank you very much.
Chapter 43.
These are the facts that we need to know about chlamydia.
C. Trachomatis. C. Sitochi. C. Pneumonia.
They are the three chlamydia species that infect humans. So what is chlamydia species? Chlamydia species are prokaryotes that differ from most other bacteria with respect to their very small size and obligate intracellular parasitism. So the chlamydia species are members of the order
Chlamydials.
and the family.
Chlamydiaceae.
In the United States, chlamydia is one of the most common STD or sexually transmitted by the bacterium.
C. Trachomatis.
So you can get an STD if you have
Unprotected sex.
So chlamydia is considered as the silent epidemic because it doesn't always have symptoms, resulting to unintended transmission and high prevalence rate.
Why should I care?
Understanding the risk of different sexually transmitted infection like chlamydia can help you make safe and informed decisions.
How can I treat it?
So it can be easily treated with antibiotics and if you follow the instructions properly. So what if you don't even know? Easy. If you are sexually active, get tested every year. Always remember that chlamydia are
Preventable. Curable. Can be treated with antibiotics. Easy to diagnose.
Yes, you heard it.
Go get checked. Treat it fast before it's bad.
Hashtag know the facts. Antibiotics typically used in infections with chlamydia.
Azithromycin, doxycycline, erythromycin and other. Macrolide antibiotics, tetracyclines and fluoroquinolones.
Things you should know about Rickettsia, Orientia, Anaplasma, and Ehrlichia organisms. Rickettsia are species in this genus are divided into three groups. First is the spotted fever group. Under this group, we have Second is the typhus group. Under this group, we have Third is the scrub typhus group. Under this group, we have We also have the Ehrlichia, Anaplasma, and Neorickettsia group. Things you should know about Coxiella burnetii. These are the clinical manifestations of Coxiella burnetii infection. Things you should know about Trophilema whippley and Klebsiella granulomatis.
Chapter 44 Mycoplasma and Ureaplasma.
Here's a video about everything you need to know about mycoplasma and ureaplasma. So, ano nga ba ang mycoplasma? It refers to a type of bacteria that is capable of infecting various parts of the human body. Different types of it affect different parts of the body. For example, the one infecting the lungs won't be the same as the one infecting the urinary tract. What sets mycoplasma apart from other types of bacteria is that these do not come with a cell wall. Additionally, these are very tiny in size compared to other types of bacteria. The types that can harm you are Mycoplasma pneumoniae, Mycoplasma genitalium, Mycoplasma hominis, Ureaplasma urealyticum, Ureaplasma parfum. Mycoplasma pneumoniae is also known as walking pneumonia. It is an atypical type of pneumonia. It is highly contagious in nature, respiratory illness that can spread from one person to the other through respiratory droplets that escape from the mouth and nose of an infected person while coughing and sneezing. It can be transmitted from one person to another, even more in crowded places like colleges, schools, etc. It also has the ability to become an epidemic. Aside from pneumonia, it can cause sore throat, tracheobronchitis, or chest colds and ear infection. Ano nga ba ang mga common na simptomas ito? Ang mga common na simptomas ito ay fever, sore throat, headache, fatigue, and cough. Mycoplasma genitalium. It is a bacteria that lives in the cells of the skin, in the genitals and urinary tract. It is a sexually transmitted disease, meaning it is spread from an infected person to a healthy one through sex. A lot of people do not experience any symptoms. However, women may experience the following symptoms of Mycoplasma genitalium: painful sex, bleeding after sex, vaginal discharge. While for men, the following symptoms are inflammation of the urethra, also known as urethritis, a burning sensation while urinating, discharge oozing of the penis. Transfer of Mycoplasma genitalium can be prevented by the use of condoms during sex. Mycoplasma hominis is found in the genitals and the urinary tract and affect mostly women as compared to men. If your immune system is weak, then you might get this infection. But other than that, there is no need to worry, as this bacteria does not cause an infection that commonly. It can be transferred from one person to another by having sex with an infected person and can also be spread from an infected pregnant mother to the baby during delivery. It may also be culprit behind developing PID or pelvic inflammatory disease in women. Pregnant women may suffer the following problems if they get infected with this bacteria: risk of ectopic pregnancy, the risk of miscarriage, and the risk of early birth. Ureaplasma urealyticum and Ureaplasma parfum mostly do not cause any issues. Ureaplasma ay transmittable through having sex with an infected individual. It can also be spread from an infected pregnant mother to the baby before birth or during delivery. Ano nga ba ang mga common nga simptomas nito? Sa mga babae, a stinging feeling while urinating, pain in the abdominal area, inflammation of the urethra, discharge coming from the urethra, foul smell, pain, and discharge from the vagina. Men who are infected by this bacteria experience swelling of the urethra, also known as urethritis. If a pregnant woman has the infection, it can negatively affect the health of the both mother and the baby. Some signs and symptoms that experienced by the infected pregnant woman are pneumonia, the low weight of the infant at birth, septicemia, or the presence of bacteria in the blood. So ayun, alam nyo na kung anong mga kailangan nyo malaman tungkol sa mycoplasma and urea plasma. Kaya guys, mag-trust, ligtas, and may alam. Bye-bye! For the continuation of TikTok video of mycoplasma and urea plasma.
Molecular method. Polymerase chain reaction PCR have been developed for the detection of the clinically relevant mycoplasma and ureaplasma species.
So, Mycoplasma genitalium has been detected directly in urine and urethral swabs in males using PCR methods targeting several unique genomic loci. In females, similar methods are used for detection from vaginal or cervical swabs.
Cultivation. The different metabolic activity of mycoplasmas for different substrates is used to detect their growth.
The medium for Mycoplasma isolation contains a beef or soybean protein with serum, refused extract, and other specific growth factors. As a result of the slow growth of these organisms, the medium must be highly selective to prevent overgrowth of faster-growing organisms that may be present in a clinical sample.
Approach to identification. Pneumonia will appear as spherical, grainy, yellowish forms that are embedded in the agar, with a thin outer layer.
The agar surface is examined under 203 to 603 magnification using a stereo microscope daily for urea plasma species, at 24 to 72 hours for Mycoplasma hominis, and every 3 to 5 hours this for Mycoplasma pneumoniae and other slow-growing species.
Surdiagnosis. Antibodies to pneumonia are typically detectable after approximately 1 week of illness, peaking between 3 to 6 weeks, followed by a gradual decline.
The most widely used serologic tests today are enzyme-linked immunosorbent assay tests, although newly developed indirect fluorescent antibody tests are being used with some success.
Ability testing and therapy. Pneumonia infections are self-limited and usually do not require treatment, but antibiotic treatment can markedly reduce or shorten the disease process.
Because of the lack of a cell wall, Mycoplasma pneumoniae and other molecules are innately resistant to all beta-lactam antibodies because this class of drugs interferes with cell wall synthesis.
Prevention. No vaccine have been developed. Use of male condoms.
There is no vaccine have been developed for the Mycoplasma, so orogenital transmission of Mycoplasma and urea plasma can be prevented through barrier protection such as with the use of male condoms.
Thank you, and that's all for cell wall deficient bacteria, Mycoplasma and ureaplasma.
Chapter 45, the
So we
spirochetes.
are talking about the spirochetes. They are found in water, soil, decaying organic matter, plants, animals, and humans. Their movement is active and accomplished by spinning and flexing about the long axis. Spirochetes are a group of 6 genera of spiral-shaped, slender bacteria of varying lengths. They are either free-living or host-associated. They are found in the human oral cavity, gastrointestinal tracts of humans, mammals, insects, and in marine environments. In addition, the examples of genera of spirochetes include Spirocheta, Treponema, Borrelia, and Leptospira. Spirochetes are long, slender, helically curved, gram-negative bacilli with the unusual morphologic features of axial fibrils and an outer sheath. These fibrils or axial filaments are flagella-like organelles that wrap around the bacterial cell walls, are enclosed within the outer sheath, and facilitate motility of the organisms.
The fibrils are attached within the cell wall by plate-like structures called insertion discs, located near the end of the cells. The protoplasmic cylinder gyrates around the fibrils, causing bacterial movement to appear as a corkscrew-like winding. Lastly, this can cause disease such as syphilis, yaws, Lyme disease, and relapsing fever.
Borreliosis is considered a relapsing fever that is transmitted by a human-specific body louse or a tick. Organisms belonging to the genus Borrelia are composed of 3 to 10 loose coils and are actively motile. Borrelia species stain well with giemsa stain. Species that have been grown in vitro are microaerophilic or anaerobic. Borrelia are the causative agents of tick-borne and louse-borne relapsing fever and tick-borne Lyme disease in humans. Human relapsing fever is caused by more than 15 species of Borrelia and is transmitted to humans by the bite of a louse or tick between 2 and 15 days after infection.
Good day, I'm your EXO today. Well, today I'm gonna suck your blood cause I'm hungry and my parasites inside my body are going crazy right now because yeah, they're also hungry, you know. Can I transmit it to you? Can I? Oh, hi! By the way, my name is Borrelia Burgdorferi. I'm here because I'm fed up with ticks, yeah, because I'm bored inside there. And here I am, yeah, your inside is so awesome, so cool, many cells, many to eat and destroy.
Lyme disease is the most common vector-borne disease in North America and Europe and is an emerging problem in Northern Asia. Hard ticks belonging primarily to the genus Ixodes act as vectors in the United States, including Ixodes pacificus in California and Ixodes scapularis in other areas. The tick's natural hosts are deer and rodents. However, the adult ticks will feed on a variety of mammals, including raccoons, domestic and wild carnivores, and birds. The ticks will attach to pets as well as to humans. All stages of ticks, larva, nymph, and adult can harbor the spirochete and transmit disease. Ticks require a period of attachment of at least 24 hours before they transmit disease. Lyme disease is characterized by 3 stages, not all of which occur in any given patient. The first stage, erythema migrans or EM, is the characteristic red, ring-shaped skin lesion with a central clearing that first appears at the site of the tick bite, but may develop at distant sites as well. Patients may experience headache, fever, muscle and joint pain, and malaise during this stage. Beginning weeks to months after infection may include arthritis, but the most important features are neurologic disorders. For example,
meningitis, and neurologic deficits, and carditis. This is a result of the hematogenous spread of spirochetes to organs and tissues. In addition, neurologic symptoms or infection may occur in the meninges, spinal cord, peripheral nerves, and brain. The third stage is usually characterized by chronic arthritis or acrodermatitis chronica atropicans or ACA, a diffuse skin rash and may continue for years. To avoid tick-infested areas, wearing protective clothing, checking the clothing, body, and pets for ticks. Removing them promptly also assists in the prevention of infection. Also, there are no vaccines against infections caused by other Borrelia species.